I'm Nick DiNubile. I'm an orthopedic surgeon specializing in sports medicine. I'm a best-selling author. I'm the vice president of the American Academy of Anti-Aging Medicine. I'm the chief medical officer for the American Council on Exercise. I'm a former special advisor to the President's Council on Physical Fitness in Sports. And I've been an H-Wave user for over 20 years. Well, as a physician, we don't want to ever see anybody in pain, but we also know that pain can be a double-edged sword. One of the biggest problems we have in our nation now is addiction to pain medicines or side effects of certain pain medications, whether it's a narcotic or even some of these non-steroidal anti-inflammatory drugs, the NSAIDs. There's a wide host of issues that can happen if people are taking those chronically, whether it's your liver, your heart, your stomach, your kidneys. So even though we want to, we want people comfortable, we have to be careful. And I'm one of these physicians who myself, when I have a problem, I don't want to turn to medicine right away. And I try to have that same philosophy with my patients. Now, I don't, sometimes people need it, and on a short term, you're going to use medications. But if you can find safer ways to get people comfortable and to get people better, my philosophy is to do it that way. And I know my patients really like that, because nowadays people don't want to take more medications. They don't want to risk side effects. So H-Wave has been perfect for us in that regard. So H-Wave has been a terrific modality for helping people who are injured in so many ways, because it has several functions. There's different frequencies it could be set at. Even though it's an electrical stim device, you have a higher frequency and a lower frequency, and they have different functions. So the higher frequency can be used when you want to control pain. And if you can control pain, that is one of the keys to getting people to recover. And in so many ways that works. And it's not just because you want people in less pain, but if you can start limiting pain, people can start functioning more normally. And I believe the body has some self-correcting capabilities that once you take away the pain and the body starts using that part more normally, you're going to recover quicker, as opposed to if it hurts too much that you want to protect it, not use it, your body goes downhill. So in addition to the anesthetic effect, you can use H-Wave at a lower frequency and get that pumping action, which is important that you get with the stim device. And unlike the pain relieving effect, this is actually a pump mechanism, and it's a physiologic mechanism to get rid of the swelling, get rid of the bad stuff that's accumulated when an injury happens, and to have good things happen, like preventing atrophy. Whenever something's hurt and you're not using it, the first thing is the muscle shuts off, the muscle shuts down. Whether it's an injury, a contusion, some fluid in your knee, any of those things, that unfortunately the muscle shuts down, and atrophy happens very rapidly. You can measure atrophy. If someone's limping, within a week you can measure thigh atrophy, and that's tough to get back. So if you can prevent that and prevent the stiffness, prevent the atrophy, prevent the swelling, that's a good thing in treating injuries and getting people to recover quicker. And H-Wave at the lower frequency has that capability. So you have the dual action and the dual capabilities, and really it's not one or the other. Most of the time you're going to be using both, and they combine very effectively to help get people back. So when the body's injured, bad things can happen, and you can get a cascade of effects, a domino type effects, where things can go downhill. And the body gets, your own abilities get short-circuited, and you don't head towards recovery. What H-Wave can do is prevent these types of things and prevent these vicious cycles that will happen in an injured body part, the stiffness, the atrophy, and those things aren't good. When the injured part is weaker, it's more vulnerable. When it's more vulnerable, it's more likely to get flared up again. When it's flared up, you're not using it, so it gets stiffer. So you get this series of things that all are happening together in a kind of a downhill spiral. And if you can break that cycle, break that spiral, you can then start recovering. So H-Wave will prevent the stiffness, prevent the atrophy, prevent the swelling, take the pain away, allow you to use that body part. Again, if it's an injury, you want it to be used in a controlled fashion under supervision, but movement is going to help you recover. Motion is lotion. When I was in my training, anytime something was hurt, we put it in a cast, and we thought we were helping people. We realized that immobilization is terrible for your body. There's times where you might have to immobilize something if you have a bad fracture, but rarely do we use this. I do knee surgeries every week, and I can't remember the last time I put somebody in a cast. We now know that movement helps recovery. So if you can enhance the body's natural movement, patterns and allow that to happen more easily, whether it's due to the anesthetic effect of H-wave or reducing the swelling or reducing the stiffness or atrophy, improving the range of motion, you're going to help that person. So again, movement is a good thing, immobilization is not, and H-wave follows right along that new philosophy of how we manage injuries nowadays, is to move them and to get them going and to minimize that vicious cycle, that downhill spiral that we even used to put people into in the early days of my training. I first saw H-wave for the first time for myself, actually. I was suffering with some low back issues like most of us do at some point in our life, and it just wasn't getting better the usual way. And I came across an H-wave device, and I had someone show me the right way to use it on my back, and it did exactly what it's supposed to do. It reduced the pain, it reduced the spasm, and it got me to where I can then do the things I needed to do, because you get caught in these vicious cycles when you're hurt, especially something like back pain, where you know part of the correction is to exercise. But if you can't do that because you're in pain, then you get stuck in these vicious cycles. So I first saw it that way, and it got me out of a jam. But then I work with a lot of high-level athletes. I've been, for over 10 years, I was the orthopedic consultant for the Philadelphia 76ers basketball team. For 30 years, I've been the orthopedic consultant and surgeon for the Pennsylvania Ballet. And both of these groups have H-wave that they use with their athletes. And I would see it over and over in the training room, and this would be the go-to device. Again, instead of thinking of giving somebody a pill to take or an injection, this is something that the athletes like because it's natural. There's no pills, there's no pain, and it's very soothing, and it accomplishes what it's supposed to. So even though I first used it on myself, and that's the first experience I had, it was then reinforced by seeing it over and over in training rooms at the highest levels. And it's a terrific device. H-wave can be used in a wide variety of injury type situations, whether you're using it for pain relief after surgery or after a fracture, or if you have somebody who's in the more chronic phase and they just can't get their strength back and you need a muscle stim unit, or if you're trying to get swelling out of an acute injury or a subacute injury. I mean, it really has the potential to be used across the entire injury recovery pattern, whether it's the acute phase, the subacute phase, or the chronic phase. Okay, as a physician, it's always important for me to not only see something work in a training room setting, or anecdotally if a patient comes and says, I tried this new thing and it seemed to work for me, and that's always nice and it gets my attention, but ultimately you want science to prove that something's working. And I was interested enough in what I was seeing with H-wave that I got involved in a really pivotal study, research with Wake Forest University, that showed and proved the effectiveness of this, that it is actually working at the cellular level. This is not just a placebo, it's not just in somebody's head that it's working, it's not anecdotal, but research that showed that when H-wave is on, that it creates blood flow to the area. And blood flow is important for healing, we know that. So when H-wave is on, you get more blood flow to an area, and then with continued H-wave use, you get something called angiogenesis, which is new blood vessel growth. So the combination of blood flowing into an area, which helps the healing process, and new blood vessel growth, that's a dramatic tissue effect at the cellular level that's proven. And so what I found with H-wave is that willingness to do the research, the necessary research, to really show that it is a unique wave and that it is creating positive changes in your body. And again, as a scientist, this is very important to me. I'm editor-in-chief of the Physician in Sports Medicine. I am very, very interested in the whole concept of evidence-based medicine. And although you can get my attention with something that's new and flashy and seems like it's working, I want to see the science eventually, and H-wave has done that. And yeah, an H-wave is different than a TENS unit. People use TENS unit for pain, and I've had mixed results with that. And this is a different unit. It is not a TENS unit. This has much more capabilities than a TENS unit. It has the anesthetic effect. It has the muscle pump action. It's a completely different device. And for me, it is. You know, I don't use TENS units. I use H-wave. And also different than a TENS unit. A TENS unit, when you're wearing it, it might relieve your pain, but as soon as you shut it off, the pain's going to come back. The H-wave creates a more lasting anesthetic effect, and again has the additional effectiveness with the pumping action. So it's a completely, you're talking about a completely different device. Unfortunately, I see people mix these two devices up, and it really is not meant that way. I rarely ever see a TENS unit in a training room or on a pro athlete. I see H-Wave every time I walk into the training room being used. H-Wave's terrific. It's helped me, it's helped my patients, it's helped my athletes, and it's something that I want to be using for a long time.